Healthcare reform in 2 states. The world is becoming smaller and smaller, and when companies look to expand, they often look outside their original footprints. Now that Rasmussen Healthcare Systems is looking to expand their system to another state, they will need to compare and assess each state's reform. The 2 states that we will be focusing on today is comparing the reforms from North Dakota and Montana. Healthcare reforms are put into place to make changes in healthcare to improve it. North Dakota's healthcare reform includes the Patient Protection and Affordable Care Act, PPACA. The purpose of North Dakota's reform is important because it is critical in the population's ages. North Dakota's reform is important because nearly 1 in every 6 residents have Medicare. Healthcare reform has a great purpose in North Dakota because they do spend most of their Medicaid funds on institutional care. As you can see, there is multiple purposes for North Dakota's reform as listed above. North Dakota also has a number of consumers involved in the healthcare reform, including health insurance, Medicare, Medicaid, young adults, and high-risk pool and cost. The Patient Protection and Affordable Care Act is a law that provides numerous rights and protections that can make health coverage more fair and easy to understand, along with subsidizing to make it more affordable. The reform is critical and needed for the population aging. Because a significant older population who can be at greater risk for chronic illness, 15% of the population is age 65 and older, and 18% is between the ages of 50 and 64. North Dakota is very dependent on Medicare health insurance because of the nearly 1 in every 6 residents. In 2008, there was 106,000 Medicare beneficiaries in North Dakota. Only great advancements have been made since the year of 2008. Many older people and those with multiple chronic conditions and long-term care rely on Medicaid. Montana's main purpose of healthcare reform is to focus on providing incentives for quality patient outcomes rather than the total of patient visits or work volume. The main purpose of this reform is being performed by the Centers for Medicare and Medicaid Services, also known as CMS. This specific reform project is called the Comprehensive Primary Care Plus model. This specific model will help change the way that payments are made to physicians in the healthcare system. Montana relies on the coverage of the topics of discussion for the healthcare reform to be covered at the Governor's Council meetings. Montana's health reform is also very purposeful when discussing Medicare and Medicaid. The federally funded health insurance program relies greatly on the state-specific collaboration for making the program as successful as possible. Montana has been working with placing policies within their state to ensure that they have adequate information to understand and reach informed decisions regarding proposed Medicaid and health policy changes at federal and state levels, and also to allow Montana's health system to adapt to new policies promptly and effectively. Since North Dakota and Montana are neighboring states, you would believe that there are quite a few similarities between the 2 healthcare reform systems and policies. Some of those similarities include the fact that both Montana and North Dakota aren't compliant with the federal laws and regulations regarding Medicaid and Medicare. Other similarities include the fact that both reforms have hopes to bring down the cost of healthcare in their designated states. The last similarity that I will discuss is that both Montana and North Dakota want to ensure that their patients are receiving quality care. North Dakota continues to state in their healthcare reform that they want to improve health outcomes through activities such as quality reporting, case management, care coordination, chronic disease management, implementing activities to prevent hospital readmission, implementing activities to improve patient safety and reducing medical errors, and also implementing wellness and health promotional activities. Whereas Montana wants to ensure their patients are receiving quality care by placing the physician's incentives. North Dakota and Montana do have differences when discussing policies. For example, Obamacare. Obamacare health insurance both offered upon open enrollments in North Dakota and Montana, but North Dakota only accepts limited insurance options. North Dakota offers Blue Cross Blue Shield of North Dakota, Medica, and Sanford Health Plan as participating insurance. whereas Montana offers 64 different insurance plans that I will not be listing. Other differences include that North Dakota requires to maintain essential coverage or they will face tax penalty, where Montana does not offer the tax penalty unless there is no initial coverage. Another major difference that I noticed from reading the two reforms was that employers in Montana do not have to provide insurance to employers, whereas North Dakota employers must offer the insurance, and they hold an employer shared responsibility for employers with more than 50 employees. Ethical issues and moral disputes become present in each state's reform. Both states come face to face with ethical issues that the citizens of the state must have health insurance. There becomes an issue with ethics when it comes to the right of privacy and entitlement. Some individuals would argue that the fact that they must have insurance when it is their own right. When looking at Montana's healthcare reform with the issuing of incentives to allow physicians to give quality care to all individuals no matter what their insurance, there rises some ethical issues. All individuals in the United States have the right to health care, no matter what health insurance you have. Moral dispute occurs when presenting a moral commitment to the moral equality of individuals is already present in our nation's system. A different kind of moral argument for this position might be derived from a view of human life as sacred as being beyond the price in its worth. Should Rasmussen healthcare systems expand? Absolutely. There's no evidence that will show you that you would regret expanding your healthcare facility to Montana. Their healthcare reform goals are very similar to North Dakota. As long as the Rasmussen healthcare system is succeeding in North Dakota, it should also be a success in Montana. The purpose of the healthcare reform is presented in Montana is very similar in the sense that they share the same outlooks, policies, and reform suggestions. The idea of Rasmussen healthcare system growing and becoming a multi-state healthcare system can only be a benefit. The positive outcomes and research have definitely outweighed the cons of moving to Montana. Another positive thing about expanding to Montana is that the idea that they were presented in the healthcare reform from North Dakota could potentially be utilized in Montana. Expanding out of the original footprint needs to be looked as a positive reinforcement for Rasmussen healthcare systems. Utilizing the government-cited websites to research the purposes of the healthcare reform and what is working well for the states that can help Rasmussen health systems make their decision about expanding to Montana. Patients who are currently going to Rasmussen health systems could potentially benefit from the facility in Montana, depending on their residence location in North Dakota. Both states are great healthcare reform candidates who work well with the federal regulations and policies. Thank you so much for your time.